Hello, all. I warmly welcome you all to the latest podcast episode of Proctology and Laparoscopic Surgery. This is Dr. Manas Ranjan Tripathy, proctologist and laparoscopic surgeon from Garden City, Bangalore. A lot is assumed about gallstones, but only a little is properly understood. In order to bridge this gap in patients between assumptions and knowledge, we regularly come up with interesting podcast episodes on various facets of gallstone disease. Also, very soon I'll be coming with a brand new micro video series on gallstone diseases. In this episode, we'll be talking about gallstones. Let's start. So, what is the origin of gallstones? The formation of gallstones is usually secondary to many predisposing factors like sedentary lifestyle, hormonal abnormalities, obesity, constipation, and consumption of a diet rich in fat. The population of India, especially from the cow belt, is highly prone to the incidence of gallstones. Multiple pregnancy associated with the hormonal changes of pregnancy are also predisposing factors leading to gallstone disease. But in most of the cases, it's a gallbladder hypomotility or a defective contraction of the gallbladder in association with one or more of these predisposing factors, which leads to the origin of gallstones. Now, what are the issues that can arise from gallstones? Gallstones may or may not have any symptoms. Most of the time, patients may be asymptomatic. However, it can cause intense pain in upper abdomen, mostly in the right upper half or in the central quadrant, which arises usually after a food intake at night or in the early hours of the morning. Pain scatters to the back, sometimes radiates to the right shoulder also, that is moderate to severe in intensity, and lasts a few hours. If the pain lasts for a longer duration, that is more than 12 to 24 hours, then there is every chance that there is a blockage of the gallbladder outlet leading to gallbladder infection, pancreatitis, or bile duct stones. So, what are the general gallstone treatments and stone sizes that need treatment? The treatment of gallstones is not decided by the size and number of stones, as in the case of kidney stones. The stone's presence and symptoms decide on the treatment. If the patient is experiencing symptoms, every stones need treatment irrespective of the size. Shortly, the patient who is symptomatic needs to be treated. Furthermore, if a patient has no symptoms and gallstones go undetected during a general checkup, the patient can usually follow up even with the presence of multiple gallstones. Now, is stone removal ruling out gallbladder possible? In the case of kidney stones, the kidneys are usually not at fault. They are healthy. It's biochemical and blood abnormalities which leads to kidney stones. But in case of gallstones, usually the gallbladder is diseased. There is hypomotility of the gallbladder, which in first place leads to origin of stones. There have been many previous attempts during the early part of the 20th century where to remove or dissolve gallstones had been attempted, keeping the gallbladder untouched. But most of them have failed and the problem had recurred within 3 to 6 months in such cases. It was clear that the gallbladder was the offender more than the stones themselves. The typical treatment for gallstones is therefore standardized as cholecystectomy or complete removal of the gallbladder along with the stones. Now, what are the health and digestive problems which can be caused by gallbladder extraction, or what are the digestive issues which a patient may face after a gallbladder removal surgery? To be very basic knowledge, the gallbladder does not produce any digestive juice or bile. Instead, it stores and concentrates the bile which is produced by the liver in between the meals. Post the gallbladder removal, the ductal system of the liver and the common bile duct, they have some amount of enlargement to lodge and store the bile. Hence, the digestive problems usually do not occur and there will be no need to to change food habits after the gallstone removal surgery. Gallbladder surgery is therefore the most common surgery performed worldwide, and there are ample scientific data to support this documentation. What if the gallbladder stones are left untreated? And is there any alternative treatment to gallstone disease? There is no scientific data at present available to prove any cure for gallstones through allopathy or non-allopathic medicines. Of course, we can offer symptomatic treatment for reduction of pain, vomiting, and other issues caused by gallstone disease. If a patient is asymptomatic, there is no need for immediate surgery and regular follow-up can be advised. But if there are symptoms, there are chances of 4% to 8% risk per year, including problems like acute cholecystitis, wherein there is acute blockage and infection of the gallbladder, jaundice, whereas there is a blockage of the stone in the common bile duct causing increase in the bilirubin levels of the body, cholangitis, gangrene, and pancreatitis. These are all very, very life-threatening conditions. Patients with gallstones are also at risk over the next 10 years from many life-threatening complications. Are the people downcasted by gallstone surgeries? The presence of gallstones can cause extreme abdominal pain along with a few complications as I just mentioned. Some signs like bloating, abdominal tightness, heartburn, indigestion, and increased frequency of stools are the most common in population that are not related to gallstones. As the symptoms coincide with these symptoms of gallstones, people get dejected as these symptoms may not be usually comforted after a cholecystectomy. With that, we have come to an end of this interesting episode and it's time for me to sign off. We will be soon back with another interesting episode in this podcast series. Keep listening to Proctology and Laparoscopic Surgery podcast. Thank you.